Dr. Fauci, it's great to speak with you, sir, and we appreciate your time. We just had a few questions for you. First, I'm curious about this Fauci effect, as it has been named. I mean, an 18% increase in the amount of med school applications nationwide, 26% increase at University of Washington. What do you make of the Fauci effect?
Well, it's very flattering that it's called the Fauci effect, mostly because I'm a pretty visible person in all of this, but it really is the entire field of medicine, how extraordinarily well they perform, the heroes and the heroines who are there on the front line, risking their own health and safety to take care of people in a very, very important event in our history. I mean, this is historic pandemic, the likes of which we haven't seen in over 100 years. So I just think it's really the discipline of medicine effect rather than the Fauci effect. But they call it the Fauci effect because I'm very visible in all of this.
And what do you think may be the effect on the healthcare industry with such a surge in applicants? What does that mean?
Well, I mean, obviously, I think that's a very good thing for the industry. We do need physicians, particularly in underserved areas, because, there's a real disparity in the accessibility to health care. I mean, if you're in a city like Seattle or here in Washington, where I am, you have a lot of good facilities to have access to care, but there are certain regions of the country, certain cities and towns and others where it isn't as much. So we still can do better, but also the entire aspect of public health, because not only just physicians who take care of patients on a one-to-one basis, but the whole issue of public health. I think we need more people in that arena.
Yeah. What would you say to these new applicants, people just getting into medical school, based on maybe what we've learned and experienced over the last year? Is it a different world for them?
Well, yeah. I mean, if someone has enough interest to pursue going to medical school and getting into medicine, or nursing school and going into nursing, you cannot really describe a more exciting field to be in if you really have any kind of an inkling to do that, because you have the opportunity of, saving people's lives, comforting people who are suffering, doing a whole bunch of things that you really feel very, very good when you've done something like that. It's a very rewarding experience to be in the field of medicine.
Yeah, I can see that. I want to ask you about Washington State, if I may, Dr. Fauci. Washington State medical professionals, the first to discover COVID-19 in the United States, yet among the last to open up the vaccine. We've had among the tightest restrictions. I'm curious your view of Washington State throughout the pandemic.
Everyone asks the questions of individual states and cities, how they did, should they be criticized or not. You don't really want to do that kind of evaluation because it's a very, very complicated issue. For the most part, the state of Washington has done well. Doesn't mean that a lot of people haven't gotten sick or haven't died, because this is a very formidable outbreak. It's killed, 570 plus thousand people in this country. So Washington has tried hard. The virus has outsmarted us at different times over the last year and a half. And you've seen what happens when that happens. You could always say you shut down too quick, you opened up too quick. I'm very reluctant to criticize anyone in doing that, except to say, just try your best.
When you wake up in the morning right now, Dr. Fauci, what's the big metric that you're looking at? What are you most, pinpointing your focus on at the present time?
Well, there are two things. One is the number of cases per day. Where have we leveled off at? We were up to a few 100,000 several months ago. We're now down to 60,000. Now we're going down to around 50,000. I'd like to see that curve go sharply down to a few thousand. It's too high now at a 7-day average of 50,000 per day. The other thing I look at is something that's very positive, is the number of people we're vaccinating every day, about 3 million people. Because our track record on vaccinations is really very good.
I don't know if you can see me here in Seattle, but I have this new mask someone sent me, Dr. Fauci. It's got your animation on it. You got your red tie and your white jacket. It's the Dr. Fauci Fan Club. It's actually a really comfortable mask. I'm curious, what do you make of this fame that you've inherited throughout all this? And I also want to ask you on that side note, what's the most interesting interview you've done? I'm sure you've done thousands of them.
I'm not going to answer the second question because it's going to insult a lot. It's going to insult a lot of people. But with regard to the fame, as it were, you really can't take that personally serious because then you get distracted. It's just, I would consider it to be surrealistic. On the one hand, you get a great deal of adulation and recognition, and on the other hand, people on the other side of the spectrum wind up threatening you and hating you. So it kind of balances off. I mean, the same time that I'm getting people writing me letters of adulation, I have people writing me death threats. So it's, it kind of balances out.
Yeah. Do you feel like this is all going to sort of pass?
Yeah, it will. The most important thing is for me to do my job. My job as a scientist, a physician, and a public health figure is to do what we need to do to end the outbreak, save lives, and make sure people don't suffer. If I do that, it's irrelevant what people think about me.
Yeah, that's a good attitude to have. Dr. Fauci, we really appreciate your time. Do you have a message for any of us here in Washington State before we let you go?
Yeah, just keep getting vaccinated. Get your people vaccinated. It is the solution to what we're going through. So the more Washingtonians that get vaccinated, the better the entire state will be.
Good advice. Dr. Anthony Fauci, the nation's doctor right now. Thank you so much for your time.
My pleasure. Good to be with you.